Have you ever wondered where some of the words that we use came from? For example, take the word error. Where did that originate? Well, turns out it's Latin, and it means wandering, to wander off a path. Well, when you wander off a path, a lot of times there's common places where people make that wrong turn. And today we're going to talk about those areas where along the path of billing where a mistake can happen. And if you're in one of those situations, hopefully you can do something about it. Hi, my name is John. I'm your healthcare hacker and your health billing pathfinder. Today, we're going to talk a little bit about common areas where mistakes occur. So if you find yourself in that situation, hopefully you can identify if a mistake has happened. But before I do so, please take a minute to like this video and subscribe to our channel below so you can stay up to date with the most recent healthcare hacks and hopefully help navigate our complex US healthcare system. Today, I'm going to talk about 3 areas where mistakes are more likely to happen from my experience. The first one is coordination of benefits. Now, a lot of us have never heard of that, but simply it means you've got 2 insurances. So let's say you're going to have surgery on your mouth. Well, should it go to your medical insurance or to your dental insurance? Or something similar with your eye. Is it vision or is it medical? And oftentimes, when those 2 insurance plans, there's a certain order they need to get billed in. For example, the medical needs to get billed first, followed by the dental or the vision. When this doesn't happen, mistakes can occur, right? So if you have to have something where you have a surgery on your mouth, or you have to have even maybe braces due to a medical procedure, always check to make sure that both insurances are getting billed and that you're not paying more than you should, right? You should never have to pay more than your medical deductible, right? Having 2 insurances only should help you, should never harm you. So just pay specific close attention to those types of situations. The second area where we see a lot of mistakes is around outpatient surgery. Many of us in our health plans require us to have a prior approval or pre-authorization before we have surgery. Basically, the health plan has to approve that outpatient surgery. Now, this typically doesn't need to happen if you're going to be in the hospital as an inpatient, stay many nights, or if it's an emergency. This is only for kind of pre-planned surgeries. Make sure that you get that prior authorization. Don't just rely on your doctor or the hospital or the surgery center. You need to make a call and make sure that you have it. Because if you don't, many insurance plans leave large financial penalties for the individual member. So they may only cover half as much as they should, or maybe not anything at all. So pay special attention. This could cost you tens of thousands of dollars, and it can be easily avoided by just making sure that that authorization is in place prior to having your surgery. A third area where we see a lot of mistakes occur is around colonoscopies and mammograms. I know, 2 of your favorite subjects. But for many of us, when we get those screening mammograms or colonoscopies for cancer, they're covered on our preventive care benefit. Now, the age can vary, but typically anyone over the age of 50 can get that colonoscopy every 10 years. And for women, it's over the age of 40. Now, pay close attention to your plan because some plans are slightly different and those guidelines do change on a semi-regular basis. But where the mistake occurs is you go in for a screening colonoscopy, but you end up with a large bill. How does that happen? Well, oftentimes it's a coding mistake. You originally went in for that preventive care visit. Maybe they found something. Maybe they found a polyp that needed to be removed. Or maybe they thought they saw a lump in your breast. Well, that can switch from a screening colonoscopy to a diagnostic colonoscopy in a heartbeat. And you'll end up with a bill. Now, the insurance will cover it, don't get me wrong. But what they're going to cover it is as a diagnostic test, which means for many of us, that will be with payer deductible, co-insurance, copay, however your plan is structured, but you're going to have to pay out of pocket. Whereas if it's preventative care, you wouldn't have to pay. So if you're going in for a preventative test for a colonoscopy or a mammogram, and you should never get a bill. If you do, something went wrong. It's typically a coding mistake. The doctor or the hospital or the surgery center put the wrong code on the procedure. Maybe they put the preventative care coding or the screening code. So ask your insurance company what happened, what went wrong, and how they can fix it. Often it's an easy fix. It can save you thousands of dollars in many cases. If you have questions or comments about this episode, please leave them in the description below. We'd be happy to answer any questions you have in future episodes of Healthcare Hacks. We really want to hear from you, and we want to address what concerns you may have around your healthcare. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.